And as Arizona doctors learn more about COVID-19, they're changing the way that they help patients, Brandon.
Yeah, our Brittany Thomason actually had a chance to speak to a Valley ER doctor about the different treatments that she's been using over the summer.
So we've learned so much. At the very beginning, we really didn't know what to do. We hadn't seen this before.
Today, Arizona doctors are more prepared to help coronavirus patients compared to 6 months ago. Dr. Arya Chowdhury says in the last few months, 4 things have been game changers when treating COVID patients: cheap steroids, lying patients on their stomachs, an antiviral medication, and using ventilators only as a last resort. The steroid dexamethasone helps patients by reducing inflammation.
We also learned that proning patients really helps. What that means is placing the patients on their stomach, which removes pressure off of their lungs. And so then blood flow changes where there's more oxygen, just better oxygenation for the patient altogether.
She says the antiviral remdesivir can shorten the time you have the virus, and those treatment options may be better than a ventilator for many patients.
You want to try to avoid that as much as possible is what we're learning.
That's because COVID patients tend to have inflammation and infections in their lungs.
And then on top of that, you are inserting a tube to push air into the lungs. You're forcing air in there. And so that causes a lot of lung trauma there. And that's just not good for the lungs altogether.
As doctors continue to learn more about this virus, she's hoping to see a vaccine soon.
The more patients we see, and as this disease progresses, we'll have more studies, and we're trying various medications, and we see what happens.
Brittany Thomason, Arizona's Family.